My name is William Del Rosario, and I am an ambassador for Disability Voices United. I am proud to present the Disability Equity Award to Dr. Mark Ghaly. Dr. Ghaly recently left his position as Secretary of the California Health Human Services Agency after being appointed by Governor Gavin Newsom in 2019. While in his position, Secretary Ghaly faced many challenges. He protected the lives of Californians with disabilities during the COVID pandemic and ensured we had access to early vaccines. Dr. Ghaly also made sure that the Medi-Cal system provided crucial health care for people with disabilities. Despite many crises that he had to deal with, Dr. Ghaly did not want to leave his position without trying to address the specific needs of people with intellectual and developmental disabilities. Earlier this year, Dr. Ghaly announced the creation of the Master Plan on Developmental Services to ensure that people with IDD are able to access the services and supports that we are entitled to. When he announced the Master Plan, Dr. Ghaly explained that he wanted it to be centered in equity and the lived experiences of people with disabilities and their families. He explained that the recommendations should apply to all systems that service people with IDD. As the master plan has unfolded, self-advocates like me have appreciated the opportunities to influence the process.
Come over this. Come over. Dr. Ghaly, I am Amina Abdul Hakim, and I'm thrilled to be joining William in presenting this award to you. Dr. Ghaly, we are honoring you today because of your tireless commitment to equity for Californians with disabilities. As a mother of a young Black man with autism, these issues hit home for me. We face each day with determination, but it's not always easy. Your background as a pediatrician shines through your work. Your advocacy for your patients with disabilities taught you lessons that you would use in your policy work. Seeing how difficult it is for us up close helped you to understand that the state of California can and should do better. We deeply appreciate your support of critical policies, calling for greater transparency in the regional center system and improving equity for communities of color. While our system still has great racial, ethnic, and geographical disparities, as secretary, you set in motion a process to break down the barriers we face. And now, as an ambassador for Disability Voices United, I would like to present to you this beautiful award featuring a painting by Sydney Edmond. Sydney lives in Temecula, California, and is a self-advocate with autism who uses AAC to communicate. She is a gifted painter and poet. I wanted to read the poem she wrote associated with this painting called All Without Words. Alone, I am alone and whirling through the universe. I speak with a voice unheard. I speak with longing and loving, wanting, wanting, wanting. Quite precious parents to know, I am in here, waiting in the wings. I am so honored to present this Disability Equity Award to you, Dr. Mark Ghaly, a heroic leader for equity and accountability for people with developmental disabilities in California. Thank you. Here, take your picture with me. Hold on. All right, can we?
All right. Wow. Well, let me start by just saying thank you to DVU and just everyone who's decided to allow me to be here with you again for a few moments and just the opportunity to celebrate together. Be honest, as I was preparing this morning and thinking about this moment, I wasn't sure what the energy would be like, just given what's happened in the election and the concerns that I'm sure many have about what comes next as a nation. And I said, gotta get there a few minutes early just to feel it out. And I'll be honest, I walked in and right away, you felt the energy, you felt the sense of being uplifted, the conversations, the connection points. And I was reminded that this group is not about a policy move, is not about what happens, next year, the next 4, whatever. This is about your lives. This is about people with real stuff going on every single day that gets boiled down into service plans and claims and whatever we call it at a more administrative level. But this drives everybody in this room in a way that most other movements don't have that same oomph behind it. And so it was my own ignorance walking in to think that that might be sort of in trouble, right? And then I'm reminded that that's really what is happening in this movement. And I think about the honor of sort of connecting the dots that I had the privilege. And to be honest, you take a job as secretary and you don't know how you got it or even why you got it sometimes. And then you do the work and you realize that, hey, this was really important to do. And it was important to do not just for me and my own family and my community, but to be part of the lives of so many other communities that I didn't know as well. And I just want to say it's been an honor to be welcomed into your community in a way, and I hope there'll be ongoing opportunities to think through where this movement goes. And Judy's right. We did a lot during my time at Health and Human Services. The pandemic in some ways was the most important distraction, but I often called it the great unmasker of inequities, but also the great accelerant for change. And so much of what California had a chance to do, whether it's in Medicaid or child welfare or aging or in the IDD space now, behavioral health, so many other areas where the work is just starting, or it continues with a little more vigor, I should say, because it didn't just start. But this work really has an exciting path in front of it. And to see the agenda that many of you either presented in or participated in, I think highlights the opportunities to achieve equity and to turn California's entitlement into an entitlement that says yes to families and people and not no. And that path could actually come together. It's not just about more money and more resources on that end, but the ability to connect some dots, the connection to the health side here. I saw, Judy and I were talking before today, and I was remembering I took care of in Bayview Hunters Point in San Francisco, my first job out of residency, running a clinic there. I took care of a young kid with autism where we could never give a vaccine or do dental care for. And then I got a call to say this young kid was in the emergency room, had appendicitis, was gonna go to the OR. And I said, wait a second, let's take this chance to connect some dots and do what this family wanted to see done and deliver that care. So this opportunity to connect the dots between what we do in the classic IDD space, but also with health, and make sure vaccines and dental care and all of the healthcare maintenance that allows us to live longer, healthier lives, whether our next Health and Human Services federal leader believes it or not, those are things that help us. There are things that help us get through, and to see that connection on the behavioral health side, the conversations, whether it's at the school or in our communities, we know that treating behavioral health conditions, period, full stop, for most of California is a challenge. But creating the resources, the energy, and the know-how, the expertise to serve people with developmental disabilities is another important challenge that we take on. So if we're going to achieve equity in this space, those are things that I know Victor and Secretary Johnson and others will be attending to and paying attention to, if for no other reason, because the faces, voices in this room that are strengthened by your own personal stories aren't going away. So it doesn't, I mean, it matters who wins in all of these different, but it doesn't matter for you, because when you go home, this is part of your life. And so the honor of being invited into that in serious ways, not just sort of superficial, can you talk about this or that? But I sat, Fernanda will tell you, sat and listened to stories in lots of different settings, and it impacts me, and I think it impacts everybody. So with that, it's with a great deal of humility, I accept this. Thank you, it's beautiful. It's right here. Actually, these are great as well. Photos of so many people that I know we're here to celebrate, support, and think about a brighter future for. So yeah, some of you know how to easily get a hold of me. Others jump through a few, but if I can ever be of assistance in this ongoing work, I'm really happy to be a part of it. So with that, thank you, thank you, thank you.
And let's get ready to have